everyone. Welcome to this episode of Aspire Ed Talk. The title is Health Challenges Faced by an Embryologist in the Present Day. This is Arthur Chang. I'm the host of this Ed Talk. I'm professor and lab director at the University of Texas Health Science Center in United States. Today, our speaker is Dr. Krishna Chaitanya Mantravadi. He is a scientific head and clinical embryologist at Oasis Center for Reproductive Medicine in India. Dr. Krishna is an expert in clinical embryology and also very passionate about human embryology and constantly researches on innovative approaches to improve the success rate of IVF. He's also an advocate for the wellness and health issues faced by colleagues of our profession. We embryologists always have a passion and perseverance for patient care. We're like a pediatrician for little embryos. The lab staff wellness and work-life balance is the key to long-term productivity in every career. The stress related to ART lab work in recent years has been emphasized and more focused because the newer generations, we focus more on the work-life balance, and we focus on the issues of the daily stress and burnout. In the United States, the Society of Reproductive Biologists and Technologists had a recent salary and job satisfaction survey on stress and burnout. And we found out that the average stress level throughout a regular week, 58% of response show high to extremely high stress, and 36% show medium stress. When asked how often do people have to work overtime in a week, 45% said very often, 35% say sometimes. And how often do you feel burnout in the past 12 months? For that question, 80% of the responses said very often or sometimes. So there are physical and mental health concerns resulted from this burnout and high stress work life. So I would like to bring in Dr. Krishna to talk about the stress, burnout, and those health challenges, especially focusing on the Asia Pacific culture. Dr. Krishna.
Thank you, Professor, for that kind introduction and taking us into this very important and often neglected aspect, which is health of the embryologist. I think, with all the audience today, I would want to share my own personal story and want to emphasize on the fact as to what makes this particular topic very close to me. I'm just 41 years old, and I was diagnosed with diabetes type 2 when I was at a very young age of 29. And I have a very strong family history, but being in the field of embryology, I think I neglected health. I wouldn't get time to work out, do regular exercises. I used to travel a lot as a part of my job, so I neglected my diet, and I would eat a lot of junk. And finally, at the age of 40, I had a block in my heart, which had to be fixed with a stent. So to cut this story short, I think it's important that we as embryologists give our best. There's so much that we do to complete the dreams of these couples who come to conceive with us. But we cannot be killing ourselves to give the best outcome. And that is what makes this whole topic so very close to me. Health of an embryologist is very important. And what is it making the whole scenario so stressful? Because we all know that IVF is a planned fraternity of medicine. There are absolutely no medical emergencies. In spite of that, I think there's a lot of burnout, stress, mental stress to the embryologists. So let's just look back. What is making it so stressful? Way back in 1978, I think IVF was very new. It was more research based. But if you look at in the current scenario, 45 years after the first IVF was done, I think the whole perspective has changed. It's no longer experimental, it's a routine medical procedure. But all said and done, the success is not 100%. And I think this is where a lot of stress is put on the embryologists. We all know in reality that 100% is not possible. But still, when we put back embryos, I think there's a lot of pressure to give the best. We always want every patient to conceive. And this blame game is probably one of the major reasons where embryologists, because of the pressure that's put on them to perform and deliver, are ending up with a lot of mental turmoil. And this is primarily causing a lot of burnout. Apart from the pressure and stress, I think 40% is the techniques what we do. Be it picking the eggs or doing the IVF ICSI techniques or vitrification. The remaining 60% is all about the paperwork we do. So there's a lot of quality control, checklists, maintenance of the equipment, cleaning of the laboratory, doing audits of the laboratory, looking into the KPIs of the laboratory, and of course, troubleshooting. And unfortunately, right from cleaning the laboratory, getting the laboratory ready, to doing all the technical process, paperwork, and troubleshoot, it's only the embryologists who have to do it. We've come a long way in this 45 years where we could do bigger interventions like PGT, vitrification, even we are now talking about gene editing, stem cell therapies, where the embryologist's skill and technical know how actually has gone better and we can do all of these things. But what has not really progressed is the availability of skilled embryologists. I think and there is still a huge scope of training and certifying qualified embryologists. And currently, what is the need of the hour is to ensure that we train adequate embryologists in the right way, where the skill is available everywhere. Right now, we are in a huge dearth there. We have very few embryologists, but the number of clinics are probably 10 times more or 20 times more than the ratio of embryologists who are skilled and trained. At times, it so happens that there's one senior embryologist who can do everything, and there are 8 trainee embryologists to support. But these trainees can only do so much in a cycle, and rest all is dependent on the senior embryologist. For the management, it sounds that they've given 9 people in the team out, of which only one can adequately perform. So, this discrepancy, this gap that is created because of a technical know how or limitation in availability of skilled embryologists is putting a lot of pressure to perform. Hence, there's overburden of what we can do and perform. And all of this is adding on to burnout. So, how do we handle this situation? Because this is going to be there. We cannot be creating another 10,000 embryologists in the next 1 month. So this gap will need years to cover it up. So how do we do this? I think this is where the government need to regulate and ensure that the work hours of an embryologist, how many cycles can be performed in a particular IVF center, all needs to be regulated. For a fixed number of cycles, a fixed embryologist is a must. And if they do not have the required staff, they shouldn't be taking too many procedures. Because ultimately, the person who's going to be at a loss is a couple who's invested just not the money, but also their dreams, their trust. And this particular unit is going to give them the best outcome. So I think a lot is needed from the statutory regulatory authorities who should be ensuring that this dearth of limited embryologists and skill needs to be taken care of. Apart from that, I think a very congenial work environment where the clinician understands the challenges of the laboratory. They should only post a limited number of cases, uh, understanding the embryologist availability, the incubator space available, and plan it accordingly. So a lot of planning is required and an open discussion. I'm sure the embryologists at times have challenges, and a congenial work environment where this is discussed across well, and of course, regular breaks. Even in a day, I have seen certain times embryologists work at a stretch for 8 to 10 hours. I think that is not acceptable at all. After every 1 hour of you being in the lab where you're not seeing the sunlight, it's advisable that you take frequent breaks, and then you would want to go take breaks, come back and do that will improve your efficiency. Weekends breaks are a must. We are not a factory, we are not robots where we could work 24 by 7. So, adequate breaks are absolutely required, which would again improve your efficiency, bring down the mental stress and your burnouts, and in turn, you're going to give the best where the outcomes of the cycle would always be the best.
Yes, exactly. I totally agree. Those are very good points. And I would like to refer to the Aspire Laboratory Guideline published recently in Fertility and Reproduction. Both Krishna and myself, we are part of the co-authors, and there's a section on adequate lab staffing. I would encourage all the clinical managers and the clinical owners, as well as the government officials, to look into those. And for the lab personnel, like ourselves, Krishna, would you have any suggestions on how we can cope and also kind of improve our like a mental and physical health?
Yes. So I think, as we said, there has to be a fixed embryologist for the fixed number of cycles we are doing. That's something that needs to be adhered to very strictly. Apart from that, I think frequent medical health checkups to see if the individual is going through any kind of physical health challenges or mental health challenges. So, for mental health challenges, a little questionnaire to see how they're dealing and coping with the stress that they put across. And physical assessment, we have put across a lot of muscular skeletal issues. We're prone for vitamin D deficiencies because we hardly expose ourselves to the sunlight. A lot of stress on the eyes. So I think frequent eye exercises and eye checkups are mandatory. So the lab managers need to focus on the fact that people do focus on their physical health. If they're really facing a lot of physical health challenges, then some kind of medical assistance to see what kind of occupational support to ensure the hazards don't bring additional health burden is important. And if the embryologist is facing a lot of mental health challenges, burnouts, then I think counseling to help them manage their time well, their work schedule well, and ensuring that adequate support system is available, which all at the end would probably help the embryologist focus more and deliver the best.
Yeah, thank you for all those great suggestions. For those who have your physical exam overdue, please remember, set up that. Thank you very much, Dr. Krishna. And we would like to thank all the audience and also the Aspire Secretariat for organizing this ED Talk. And please look for the next episode of ED Talk. And thank you all. Thank you.